Bismillahirrahmanirrahim. Assalamu alaikum. I hope all of you to be fine and doing well. Stay safe, stay blessed. Today, we will discuss minerals, the definition of mineral, classification of minerals, and we will discuss the sources, recommended daily allowance, serum levels, absorption excretion, and disorders related to an increase and a decrease in the amount of magnesium, zinc, chromium, and selenium. Coming to the learning objectives of today's lecture, at the end of this session, the first year MBBS students may be able to know the definition of minerals. They may define major and minor minerals, the classification of minerals, the recommended daily allowances, serum levels of magnesium, zinc, selenium, and chromium, the sources of magnesium, zinc, selenium, and chromium. Functions, absorption, excretion of magnesium, zinc, selenium, and chromium. Disorders related to an increase and a decrease in the amount of magnesium, zinc, selenium, and chromium. Now, coming to the definition of minerals. Minerals are inorganic substances or elements which are required in small amounts by the body. Like the organic vitamins, the inorganic minerals are required in small amounts, that is an amount of milligram or microgram. Together, vitamins and minerals, they are called micronutrients because they are required in small amounts and they have various cellular functions. The other nutrients, macronutrients, they are required in large amounts. These include the carbohydrates, proteins, and fats, which are required in amounts of grams, and they are actually energy yielding nutrients. Minerals function in a number of processes, including the formations of bone and teeth, fluid balance, nerve conduction, contraction, signaling, and catalysis. These functions of minerals will be discussed under the individual minerals. Now, coming to the classification of minerals. One classification of mineral is based according to their function. Calcium, magnesium, and phosphate. These minerals have a structural function. Sodium and potassium are involved in membrane function. Cobalt, copper, iron, molybdenum, selenium, and zinc. They function as prosthetic group and enzymes, enhancing the activity of the enzymes. Calcium, chromium, iodine, magnesium, manganese, sodium, and potassium have a regulatory role. They have a role in hormonal action. Silicon, vanadium, nickel, and tin, these minerals are essential. Our body needs them, but their function is still unknown. Fluoride and lithium are minerals which have effects in the body, but it is not established that whether they are essential or not. Arsenic, aluminium, antimony, boron, bromine, cadmium, cesium, germanium, lead, mercury, and strontium. These minerals are collectively called as toxic minerals. They occur in food and in high quantities they are toxic. They have various adverse effects. Now, this is the basic classification of minerals. Minerals are classified into two main categories. Macrominerals are major minerals and microminerals are minor minerals. The micro minerals are minor minerals are further divided into micro minerals trace and micro minerals ultra trace. The macro minerals are those minerals which are required in large amounts, that is more than 100 milligram per day. Whereas the micro minerals are those minerals which are required in small amounts, that is less than 100 milligram per day. Among the micro minerals, the trace minerals are those which are required in amounts between 1 milligram and 100 milligram per day, whereas the ultra trace minerals are those minerals which are required in less than 1 milligram per day. The macro minerals include calcium and phosphorus, which are the main minerals involved in sexual function, together with serum electrolytes. The serum electrolytes comprise of magnesium, sodium, potassium, and chlorine. So, calcium, phosphorus, magnesium, sodium, potassium, and chlorine are included in macro minerals. The micro minerals ultra trace includes selenium, iodine, and molybdenum. Ultra trace minerals, SIM. Selenium, iodine, and molybdenum. The rest of the minerals are included in trace like iron, zinc, chromium. Now, coming to macro minerals are major minerals. As I told, macro minerals are those minerals which are required by adults in the largest amounts, that is more than 100 milligram per day. The macro minerals include calcium, phosphorus, magnesium, sodium, chloride, and potassium. These four which are underlined, these comes under the category of serum electrolytes. So macro minerals include calcium, phosphorus, and serum electrolytes. Microminerals trace. The minerals required in amounts between 1 milligram and 100 milligram are called microminerals trace. The trace minerals include copper, iron, manganese, zinc, chromium, and fluorine as fluoride. The microminerals ultra trace are those minerals which are required by adults in amounts less than 1 milligram per day, and these include selenium, iodine, and molybdenum. Now, coming to the individual minerals. First of all, we will discuss magnesium. Magnesium is a macro mineral, a major mineral. Major minerals are those which are required in amount more than 100 milligram per day. It is essential. Our body cannot synthesize it. We must take magnesium in our diet. Magnesium is the fourth most abundant and important cation in humans. Magnesium valency is +2. It is extremely essential for life and is present as an intracellular ion in all living cells and tissues. Coming to the sources of magnesium. The average daily intake of magnesium in humans is 250 to 300 milligram, and much of this magnesium is obtained from green vegetables. In green vegetables, magnesium is found in the porphyrin group of chlorophyll. Among the four sources of magnesium, almost all animal tissues contain magnesium. Other sources of magnesium include cereals, including wheat, maize, barley, beans, green vegetables, potatoes, almonds, and cheese. The plasma level of magnesium is 1.5 to 1.8 milliequivalent per liter. Now, coming to the functions of magnesium. Magnesium is required by a variety of enzymatic reactions, including phosphorylation by kinases and phosphodiester bond formation by DNA and RNA polymerase. The magnesium acts as a cofactor and activator in these enzyme action. High levels of magnesium depress nerve conduction. About 70% of the body magnesium is present in bones, dental enamel, and dentine. Now, coming to the excretion of magnesium. हाइपोमैग्नीसीमिया हाइपोमैग्नीसीमिया में क्या होगा ब्लड में मैग्नीशियम का लेवल कम होगा नॉर्मल से कम होगा वेयर एज हाइपरमैग्नीसिया में ब्लड में मैग्नीशियम का लेवल सीरम में मैग्नीशियम का लेवल नॉर्मल से हायर होगा hypomagnesemia can result from decreased absorption or increased excretion of magnesium अगर मैग्नीशियम की एब्जॉर्प्शन कम होगी तो मैग्नीशियम का लेवल कम होगा सिमिलरली अगर मैग्नीशियम का एक्सक्रीशन ज्यादा होगा तो भी मैग्नीशियम का लेवल कम होगा magnesium deficiency the most common cause of magnesium deficiency is alcoholism the symptoms of magnesium deficiency or hypomagnesemia include hyperexcitability of skeletal muscles and nerves and cardiac arrhythmias. Low levels of magnesium may produce hypomagnesic tetany. Grass tetany or hypomagnesic tetany is a metabolic disease involving magnesium deficiency and it occurs in cattle and sheep which graze in pastures of rapidly growing grass, especially in early spring, grown on soil deficient in magnesium. The symptoms of hypomagnesemic tetany include irritability, muscle twitching, which is involuntary contraction or relaxation of skeletal muscle, staring, lack of coordination, head thrown back, coma, and followed by death. Other symptoms of magnesium deficiency include restlessness and convulsions. Coming to hypermagnesemia or higher levels of magnesium. Raised values of magnesium have been reported in the following three conditions. Uncontrolled diabetes mellitus, hypothyroidism, and renal failure. With hypermagnesemia, hypotension is seen. Magnesium sulfate is used in the treatment of preeclampsia, a hypertensive disorder of pregnancy. Preeclampsia is usually a condition in which the blood pressure is raised in pregnancy and it is characterized by fluid retention and proteinuria. The preeclampsia usually begins after 20 weeks of pregnancy. The risk factors for preeclampsia include obesity, prior history of diabetes mellitus, old age, and prior history of diabetes mellitus and prior history of hypertension. Now, we will discuss zinc. Zinc is a trace element and it is essential. Our body cannot synthesize it, so we must take it in the diet. The deficiency of zinc can lead to serious disorders. Zinc absorption is better when we get zinc from animal sources. Coming to the food sources of zinc. Good sources of zinc are liver, milk, dairy products, and eggs. Good vegetable sources are unmilled cereals, legumes, pulses, oil seeds, yeast cells, and vegetables. An adult man contains approximately 2 grams of zinc in the body. Only a small percentage of the zinc which we take in our diet is absorbed, and the absorption of the zinc takes place from the duodenum and ileum of the small intestine. In healthy adults, approximately 9 milligrams of zinc is lost in feces, about 0.5 milligram in urine, and 0.5 milligram is retained in the body daily. Whole blood contains about 650 to 680 micrograms of zinc per 100 ml. Plasma contains approximately 120 to 140 microgram of 100 per 100 ml of zinc. That is 100 ml of plasma will contain 120 to 140 microgram of zinc. Daily requirements. The recommended requirements for normal health is 0.3 milligram of zinc per kg body weight. Adult men and women require about 15 to 20 milligram of zinc per day. In pregnant and lactating women, the requirement of zinc is increased up to 20 milligram per day, whereas infants and children require 3 to 15 milligram of zinc. Coming to the functions of zinc. Zinc have a role in enzyme action. Zinc is an integral part of several enzymes in the body. Important zinc containing enzymes include superoxide, dismutase, carbonic anhydrase, alkaline phosphatase, and alcohol dehydrogenase. The other function of zinc is that it has a role in vitamin A metabolism. Zinc stimulates the release of vitamin A from liver into the blood, thereby increasing the level of vitamin A in plasma and its utilization and the synthesis of rhodopsin. Zinc also has a role in insulin secretion. Zinc has a role in the storage and secretion of insulin. Role in growth and reproduction. Zinc deficiency may lead to dwarfism and hypogonadism. In dwarfism, the stature will be short, the organism will be extremely small. In humans, if the adult height is less than 147 centimeter, we label him as a dwarf. In dwarf individuals, the intelligence and life expectancy is none. Hypogonadism, diminished functional activity of the gonads, the testes and ovaries, it results in diminished production of the sex hormones. Zinc has a role in wound healing. Zinc is necessary for wound healing. Zinc deficiency delays wound healing. Role in biosynthesis of mononucleotides. The biosynthesis of mononucleotides and their incorporation into the nucleic acids has found to be impaired in zinc deficiency. The ribonuclease activity has been reported to be higher in zinc deficiency. When the activity of ribonuclease is high, the degradation of RNA into smaller compounds will be at a higher rate. Coming to the deficiency of zinc. Causes of zinc deficiency. The cause, it may be due to inadequate zinc in the diet. If we take less zinc in diet, we will have zinc deficiency. If we are unable to absorb zinc from the intestine, we will have zinc deficiency. Similarly, if we excrete large quantity of zinc and urine, we will have zinc deficiency. So the causes of zinc deficiency include inadequate zinc in diet, intestinal malabsorption, and excess urinary loss of zinc. Clinical features of zinc deficiency include anorexia or lack of appetite, poor growth, inadequate sexual development, acne-like rash, mental confusion, and depressed mood. Now, Coming to acrodermatitis enteropathica, which is a deficiency of zinc absorption, genetic disorder of zinc absorption. Zinc deficiency may cause acrodermatitis enteropathica. Acrodermatitis enteropathica is a genetic disorder of zinc absorption presenting in the infancy, usually before the age of 1 year, characterized by a triad of acral dermatitis, alopecia, and diarrhea. The dermatitis may involve the face, hands, feet, anogenital area, the area around the eyes, and the area around your mouth. So the features of acrodermatitis enteropathica include diarrhea, dermatitis, and alopecia. Nearly identical clinical findings occur in older individuals with acquired zinc deficiency, which is either due to dietary deficiency of zinc or failure of intestinal absorption of zinc. Causes of acrodermatitis enteropathica. Acrodermatitis enteropathica is due to malabsorption of zinc through the intestinal cells. It is an autosomal recessive disorder. It is inherited in autosomal recessive manner. An individual to have congenital acrodermatitis enteropathica, one must inherit two defective genes, one from each parent. Up till now, all the disorders which are genetic and your first year course, they are inherited in autosomal recessive disorder, autosomal recessive manner. Who gets acrodermatitis enteropathica? Symptoms usually occur in bottle-fed infants within a few days or weeks after birth and in breastfed infants soon after weaning. Bottle-fed infants में जिंक डिफिशियंसी के सिम्टम्स जल्दी आ जाते हैं क्योंकि वो ब्रेस्ट मिल्क जब नहीं लेते, ब्रेस्ट मिल्क में जिंक मौजूद होता है, इसलिए ब्रेस्ट फेड इन्फेंट्स जब वीनिंग उनकी स्टार्ट होती है, जब वो अदर फूड्स, वीनिंग मींस कस्टमिंग द इन्फेंट टू फूड अदर देन द ब्रेस्ट मिल्क, उस वक्त उनमें जिंक डिफिशियंसी के सिम्टम्स नजर आना शुरू होते हैं. Symptoms usually occur in bottle-fed infants within a few days or weeks after birth and in breastfed infants soon after weaning. The reason is that the breast milk contains zinc. Both sexes are equally affected. Zinc deficiency may also rarely arise in adults, which is called acquired zinc deficiency. Causes include inadequate zinc in diet, intestinal malabsorption of zinc, and excessive loss of zinc in the urine. Coming to the clinical features of acrodermatitis enteropathica. The skin findings include red and inflamed patches of dry and scaly skin, particularly around the body orifices, such as the mouth, anus, the eyes, and the skin on elbows, knees, hands, and feet. Patches evolve into crusted, blistered, frost-filled, and eroded lesions. There is usually a sharp demarcation between the affected area and the normal skin. Other feature of zinc acrodermatitis enteropathica is a diffuse hair loss or alopecia on the scalp, eyebrows, and eyelashes. Secondary infection with Candida albicans and Staphylococcus aureus and impaired wound healing is also a feature of acrodermatitis enteropathica. This is a slide which shows the clinical feature of acrodermatitis enteropathica. You may see that the skin lesions are found around the mouth, the eyes, and on the feet. The affected skin is erythematous, that is, it is red. There are erosions, it is inflamed, and there is crusting over here. This is another slide which shows the clinical features of acrodermatitis enteropathica involving the anogenital area and fingers of the children. Coming to the treatment of acrodermatitis enteropathica. The inherited form of AER was usually fatal until the role of zinc was discovered in 1973. It should be treated with 1 milligram per kg per day of oral zinc supplementation, and the treatment should be lifelong. The zinc gluconate is better tolerated than zinc sulfate. It is better absorbed and it have fewer adverse effects than zinc sulfate. Secondary infections of lesions required appropriate therapy. If the secondary infections are due to Candida albicans, we will need antifungals, and if it is secondarily infected by Staph aureus, we will need to add antibiotics to the therapy. Although zinc is non-toxic, high doses of zinc for a long period can result in gastrointestinal symptoms, dizziness, and copper deficiency. The deficiency of zinc and the deficiency of copper, they both cause anemia. This is a slide which shows the children with acrodermatitis and enteropathica before zinc supplementation, and you may see marked improvement only after 5 days of zinc supplementation. This is another slide which shows the clinical features of acrodermatitis and enteropathica before treatment and after treatment. This is another slide which shows the clinical features of AE before and after treatment with zinc supplementation, and in 5 days you may see marked improvement as evident from these slides. Coming to the toxicity of zinc, the toxic level or upper limit of zinc is 40 milligram per day. The normal level is up to 25 and the toxic level is 40 milligram. Above 40 milligram, if we take zinc more than 40 milligram per day, the toxicity of zinc will be manifested. Higher levels of zinc inhibits copper absorption. Higher levels of zinc reduces the high density lipoproteins and increases the risk of heart disease. Symptoms of zinc toxicity include nausea, vomiting, diarrhea, and cramps. Now, we will discuss selenium. Selenium is an ultra trace mineral, which means the requirement of selenium is less than 1 milligram per day. The recommended daily allowance of selenium is 55 microgram per day for adults. Selenium is found in nearly 25 human proteins, which are known as selenoproteins, is a constituent of the amino acid selenocysteine, which is derived from serine. Food sources of selenium include fish, meat, organ meat, that is meat from kidney and liver, eggs, milk, and shellfish. Selenium is also found in grains, including wheat, maize, barley. It is found in seeds and nuts. Grains have a variable content of selenium, and the content of selenium in grains is in turn dependent upon the content of selenium and the soil. Functions of selenium. The most important function of selenium is that it acts as an antioxidant, and similarly, vitamin E also acts as an antioxidant. It enhances the antioxidant activity of vitamin E. What are antioxidants? Compounds that inhibit oxidation. Oxidation is a chemical reaction in which free radicals are produced, and these free radicals cause cell damage to the organism. The free radicals have unpaired electrons in their valence shell, and they cause cellular damage. As a selenium is a cofactor for glutathione for oxidase. Selenium is a constituent of glutathione for oxidase. It has a cellular antioxidant function, and it protects the cell membranes against oxidative damage by hydrogen peroxide. is a constituent of glutathione for oxidase. Selenium is also important in preventing lipid for oxidation and protecting cells against superoxide and some other free radicals. Lipid peroxidation is actually oxidative degeneration of lipids and free radicals steal electron from lipids and cell membranes, resulting in cell damage. Selenium protects the heart and other cells from oxidative damage, and selenium also have a role in cancer prevention. Coming to the absorption and excretion of selenium. Selenium is readily absorbed from the gastrointestinal tract. It is excreted in urine and feces. Deficiency of selenium. Symptoms of deficiency, manifestations of deficiency, selenium deficiency include muscle pain, muscle wasting, cardiomyopathy, a disease of the heart muscle that makes it harder for you to pump blood to the rest of your body, and cardiomyopathy may lead to heart failure. Kishan disease, which was first identified in China, is characterized by heart disease in children, accumulation of fatty acid peroxides in the heart, increased blood clots, and the Kishan disease is irreversible. The patients who are on dialysis are more at risk of zinc deficiency. Kishan disease was first identified in China. It is a cardiomyopathy caused by eating food from selenium deficient soil. Coming to the toxicity of selenium or selenosis, it is caused by over-ingestion of supplements. Upper level of selenium toxicity is 400 microgram per day. It is characterized by garlicky breath. There will be loss of hair and nails, and the hair and nails become brittle in selenium toxicity. Other symptoms of selenium toxicity includes weakness, nausea, vomiting, and rashes. Selenium toxicity may cause cirrhosis of the liver as well. Now, coming to the chromium. Chromium is a trace mineral. The recommended daily allowance of chromium is 20 to 30 milligram per day for adults. Chromium is found in yeast, grains, meat, and egg yolk. Plant sources depend on the soil content. Adult human body contains 6 milligram of chromium. The serum levels of chromium in normal healthy adult is about 6 to 20 microgram per 100 ml. Functions of chromium. Chromium functions in the control of carbohydrate and lipid metabolism. Chromium enhances the action of insulin. It enhances the action of insulin by boosting insulin receptors activity. It increases the glucose uptake into the cell. Chromium enhances the conversion of glucose into fats. Chromium is reported to lower the cholesterol levels. So overall, chromium have a cardioprotective effect. Absorption and excretion of chromium. Chromium is poorly absorbed from the diet and it is excreted through urine. Coming to chromium deficiency. Chromium deficiency may result in glucose intolerance, weight loss, elevated blood cholesterol, and triglycerides. And the symptoms of chromium deficiency are reversed when we take chromium in diet or we take chromium supplementation. Toxicity of chromium. No toxicity from foods. No upper level is set from chromium for chromium toxicity. Chromium toxicity occurs when persons are exposed to chromium waste sites. The manifestations of chromium toxicity include allergic contact, dermatitis, and lung cancer. Oral intake of chromium can result in damage to the gastrointestinal tract, and it may also cause renal failure. Multiple choice questions in today's lecture. The serum magnesium level ranges between, the correct answer is between 2 to 3 milligram per deciliter. Now, zinc, this MCQ is based on the functions of zinc. Zinc is involved in the storage and release of insulin. Zinc deficiency results in a condition known as acrodermatitis enteropathica, which is inherited in autosomal recessive manner. It is in autosomal recessive disorder of zinc deficiency. Healing of wound may be impaired and the deficiency of zinc. Zinc deficiency may lead to impaired wound healing. A trace element having antioxidant function is chromium. The vitamin which have antioxidant function is vitamin E. Together, chromium and zinc, they have chromium and vitamin E, they have antioxidant activities. Selenium supplements the function of a trace element having antioxidant function is actually selenium, and selenium supplements the function of vitamin E in its antioxidants activity. It is selenium rather than chromium which have the antioxidant function. The antioxidant function, it is selenium. Selenium supplements the functions of vitamin E. Both have the antioxidant properties. Functions of chromium include all of the following except chromium functions. The first three are actually the functions of chromium. Chromium functions in the control of carbohydrate and lipid metabolism. It enhances insulin action by boosting insulin receptor activity, and chromium is reported to lower the cholesterol levels. So, chromium is reported to raise the cholesterol levels. It is exception. The other three are actually the functions of chromium. So the right answer is number 4. Thank you. बस टाइम खत्म शो करना बांधला म्हणून जो व्हायला गौडशे पुरा शो पाव कम तर मला कळाव का माझी 15 मिनिट पातीशी येऊ Thank you very much. Please stop recording. And now you may prepare for your Juma prayers. Stay safe and stay blessed. And do concentrate on your studies. Thank you very much. Assalamu alaikum.